So the purposes today are to really go through what we have from Immunize, to highlight the resources and also tips on how to use those to improve the vaccination experience, which is very broadly defined, and specifically to address vaccination anxiety, which is really talking about needle anxiety or anxiety around patients receiving shots. We want to look at what we have that's evidence-based, our electronic content for print, video, all of those that support positive and confident vaccination encounters. And some of this content is for providers to train them, and some is directly to give to the patients. So we want to share the simple tips and tricks we have for how to find what you're looking for on our main website for providers, which is immunize.org, but also on our 2 sites for the public. We'll talk about what those are. Our second webinar that we wanted to that we want to highlight is in conjunction with the University of Toronto. Its topic is reducing pain and anxiety for children and adults in the vaccine experience. So it offers simple evidence-based strategies to reduce the anxiety, the apprehension, the pain from needles when receiving vaccines. And then they have a really helpful approach called the CARD approach, which stands for the techniques of comfort, ask, relax, and distract as a helpful mnemonic. There's a lot of information in this webinar. It's about an hour long. We certainly recommend that you view the whole thing, but to call out one specific thing here, this CARD technique. So we want, they have developed this and tested this and validated this. So different techniques on how to make the patient comfortable, making sure that the patient knows that they can ask questions, answering all of their questions, addressing what's going to happen, what to expect, relaxation techniques, and a few of those are listed down in the bottom of the slide. And also, as we've mentioned several times, the importance of distraction. So putting your attention on something else, whether that's electronic or whether that's something physical like a book or a magazine, or something auditory like listening to music, is certainly a way to reduce the anxiety. So our next piece of content that we have is some videos. So our CEO, Dr. Kelly Moore, has been doing this on a lot of topics, not just on improving the vaccination experience, but she does short videos that are 3 to 4 minutes. These are shared on our social media. They're available on our YouTube channel. And we have gotten a lot of great feedback that people use this for, say, at a health system, outreach to providers. They use it for onboarding. They use these videos for continuing education, for micro-learning, where you can send these out and people can just spend a few minutes to learn more about best practices for immunization. So we have 3 of these videos on the anxiety. So this sort of mirrors what we've done on our print handouts, our PDFs, but we have one for infants, one for children, and then strategies for healthcare professionals. And so we also have some additional ones. There's a total of 6 videos. We have a video on how to administer multiple IM vaccines. So for example, 2 injections in 1 deltoid versus having to use, prep and do 2 different arms and have 2 sore arms instead of 1. How to use our enhanced screening checklist for contraindications for vaccination, and one specifically on the syncope and the fainting related to vaccination that summarizes what's in our other clinical resources.
So David just shared with you our suite of materials focused on improving the immunization experience, but we have many other materials that can be used to help patients have a better experience when getting vaccinated. And a really important part of improving the experience for patients is recognizing that everyone has different levels of information needs. So addressing questions and providing information parents and patients' desire is all part of this experience. It's important to remind recipients and make sure that they understand which vaccines they're receiving, why they're getting them, the benefits and risks of those vaccines, and what to expect after the shots are given. And this is our Vaccines A to Z webpage, and this will help you answer just about any patient question that arises. So these web pages have detailed content on each vaccine preventable disease. There are links to clinical resources that can be downloaded and printed for your office setting for healthcare providers. We have Ask the Experts questions and responses related to each vaccine preventable disease. So some of those really tricky exceptions that come up and situations that come up in an office setting, we have many of these questions that have been submitted by healthcare professionals, and our CEO, Dr. Kelly Moore, and a team of experts answer them. We also have resources on federal and state recommendations, vaccine information statements, and different policies at the state level that might be impacting some of these vaccines. We have 174 different resources in English, including 118 for healthcare professionals and 61 for vaccine recipients. We also have 18 different languages available. And as we know, patients really benefit from having vaccine information available in their own preferred language. Our downloadable patient handouts, and translated screening questionnaires make it easier for you to meet your patient's needs. So here we've shown our filters on the website just to give you a glimpse, and David will go into it in a demo in a little bit, but of the different ways that you can locate what you're looking for. So for instance, you can search by all patient handouts if you're looking for something to give a patient. You can look for all resources for staff and providers if you want more of a clinical focus. You can search by translations or a specific topic. And our resources are regularly updated and announced in our weekly newsletter, IZ Express. So if you're not signed up for IZ Express, we'll give you a link at the end of the presentation, because that's where you're going to get all of the latest and greatest resources that we offer. David, is there anything that you wanted to add on to that?
No, I think that covers it well. I mean, obviously,
Great.
Somewhat resource limited, but there definitely is, as Courtney mentioned, a value of knowing what providers would like to have that we don't have currently translated, and that helps us prioritize.
Definitely. Thanks. Could you go to the Ask the Expert slide, David? Thanks. So this is another wonderful resource for healthcare providers, and it's one of our most frequently visited sections of our website. There's over 1,300 entries, and it really provides practical, timely answers to your questions. There are 5 subsections to explore. So that includes the Ask the Experts overview, view all questions, view all video questions. So those are short video snippets from our CEO, Dr. Kelly Moore, answering those questions in more of a verbal question and answer as opposed to written, which is how it appears on our website. You can search that by vaccine topics and general topics. And you can also narrow your search by entering a word or phrase into the keyword search. So for instance, if you're searching for hepatitis B serology, you can add that into the keyword search, and it really kind of narrows the parameters of those 1,300 different entries to what you're looking for. This is our newest website. We're really excited about it. It's the Let's Get Real About Vaccines.org website. This is a trustworthy, parent-friendly platform that delivers factual vaccine guidance, and that guidance is focused on the pediatric population. Also includes vaccines that are recommended for preteens and adolescents as well. This website equips providers with tools to help advocate for childhood and adolescent immunization confidently, and supports families by providing credible, unbiased information about childhood vaccines. So some of the key features of the Let's Get Real website include personal stories to convey important facts, plain language to debunk misinformation, and you can see here some of the images are available for download and can be shared on social media, and they debunk many of those common misinformation or common myths that exist about vaccines, such as here an example is the chickenpox vaccine safer than going to a chickenpox party or getting natural immunity. And so these are really on some very commonly asked questions. Another exciting feature of this website is that it's available in English and Spanish. So you can toggle on and off of the Spanish translation in the top right corner of the website. And so the entire website is available in Spanish, which we're really excited about. Vaccineinformation.org is our educational site for the public, offering straightforward information for people of all ages about VPDs or vaccine preventable diseases, and the vaccines to prevent them. It's organized by age group, so you can toggle on and off vaccine information for infants and children, preteens, teens, and adults. And some of the different subsections include vaccines that you need. This section goes over schedules, resources to help you better understand the schedules, and links to places to find places to get vaccinated. There are resources both from immunize.org as well as other reputable organizations such as the Vaccine Education Center at the Children's Hospital of Philadelphia, American Academy of Pediatrics, Vaccinate Your Family, and many others. There's personal testimonies and videos that you can scroll through on this site as well.
But to kind of show you where the resources that we talked about today are, I'm here on the home page. You'll see our menu across the top. The main resources that we talked about today are under our clinical resources tab. And so if you start with clinical resources, you'll see all of the different topics we have. And Courtney kind of mentioned, we have over 200 different PDFs that are clinical resources. One place you can find just the documents, so the PDFs, is here under clinical resources, which is the default top item on the left. And then the first item after the categories and the highlighted ones are addressing vaccine anxiety. And so when I select that, what's going to happen is it's going to automatically filter to those documents that we talked about, so our webinars and our videos. And so that is available also on our clinical resources. So it's down on the bottom, the last subtopic that we have. So first, when we see our webinars, and a lot of our webinars here are office hours updates. So here's where getting a filter, and if you go to improving the vaccination experience under the subject filter, you very quickly can filter down to these two webinars that we kind of highlighted in our PowerPoint presentation. So in this green box here, we have vaccine information, our website that covers the range of ages from children all the way up through adults. And so you're going to see all of these resources that we have mentioned here. And one of the vaccine basics subtopics or pages, these are alphabetical, is improving the vaccine experience. And so here the public or patients can find those documents that are the strategies that we have, also links back to the videos, and then some additional resources that we mentioned, such as those with the Autism Society and then the University of Toronto. If you go to the first tab, which is Learn About Children's Vaccines, it's the second item, Vaccine Preventable Diseases. Each of these items, which you can actually click up here to filter by which vaccines a certain age group. So we get, so if I go, I looked at flu, but we'll look at something like the measles vaccine. If you click on one of those cards, you get a full page that talks about the disease, why it's important to vaccinate, why the vaccines are safe. But if you scroll down there a little bit, you will get this, image, which is, I think what you're asking about is, you have the measles, and the measles is very severe disease. And then you have the, being realistic that vaccines do have side effects, but talking about what those are. So this is available here on this page. And so there is this information available for all of these vaccines. If you have questions, if you have requests, if you have feedback for us, we love to hear it, engage with you. And so, we really appreciate this opportunity to present this content. We hope that it does help you improve the quality and safety of the services offered.